Welcome to Beat Cancer, the official podcast of the UC Davis Comprehensive Cancer Center. Thanks for joining us today as we have in-depth discussions of the science, research, and advancements taking place at our National Cancer Institute designated Comprehensive Cancer Center. I'm Chris Joyce.
And I'm Stephanie Winn. We will also examine proactive approaches to cancer prevention, and most importantly, how we are breaking barriers to beat cancer in our community and beyond. Today, we're talking with Dr. Julie Deng, who is the Executive Director for the Office of Community Outreach and Engagement. She is also co-chair of the California HPV Vaccination Roundtable's Engaging Health Systems and Providers Workgroup. Dr. Deng is also a cancer health disparities behavioral researcher with over a decade of experience engaging diverse and underserved communities in cancer control and prevention. Thanks for joining us today, Dr. Deng.
Thank you for having me.
Let's start with just defining what HPV is and its relationship to cancer risk.
So HPV is a sexually transmitted infection. And you can get HPV by having intercourse. So it could be vaginal, anal, or oral sex with someone who has the virus. But it's most commonly spread through vaginal and anal sex. It also does spread through close skin-to-skin contact with the person during sex as well.
You don't think of sex having a cancer risk related to it. But when it comes to the human papillomavirus, it absolutely does. In fact, we now know that 90% of cervical cancer is tied to HPV, correct?
Yes, that is correct. So it's also estimated that 8 out of 10 people will get an HPV infection some point in their lives. So it's very common. It's actually the most common STI.
And it usually doesn't cause problems.
So a person, you can have HPV and pass the infection to another person, even though there's no signs or symptoms. But there are hundreds of different types of HPV, but only 13 of them are considered high-risk types that can cause cancer.
And we're finding more and more cancers that could be related to HPV, head and neck cancers, several other types of cancers, right?
That is correct. So while HPV is mostly associated with cervical cancer, but there is a rise of oropharyngeal cancers. And other cancers that HPV cause include vulva, vaginal, penile, and anus cancers. But then also it causes the majority of genital warts as well. So not a cancer, but something that you probably do not want to have.
Exactly. And the head and neck cancers, it's so interesting to me. So what do those include?
The head and neck cancers, we call them oropharyngeal cancers, but they're the cancers at the back of the throat. So it's the base of the tongue and the tonsils. And
they're difficult to treat, correct?
Yes, they are. They happen more commonly among men than in women, and there is a rise of that. And it's expected that oropharyngeal cancers might outpace cervical cancer in terms of HPV infections in the future.
Interesting.
Who's the most susceptible to HPV-related cancers?
I think everyone is susceptible to it. Like I did mention, it's 8 out of 10 individuals will get it in their lifetime. So if you're a sexually active person, even if you have sex with just one person, you can still get HPV. And you could develop the symptoms years after having sex with that person who's infected. That's why it's really hard for folks to know when they got it and when the infection actually occurred.
Is this something that can be screened for?
So there is an HPV test. The HPV test is only available to women. There's no HPV test that exists to detect the virus in men. However, men who are infected with HPV can pass that virus to their sexual partners. So the HPV test checks cells for infection with the high-risk types that can cause cervical cancer. And then there's also a Pap test. So the Pap test collects cervical cells and they check them to see if there are any damages caused by HPV. Normally the HPV and the Pap co-test occur together, and they check for both the high-risk HPV types and then any cervical cell changes.
So is one test better than the other? The PAP versus the HPV, or do you advocate that they are always taken together, at least rotated year over year?
The recommendation is co-testing, but like I mentioned earlier, the HPV test is available to women only. It's normally with your Pap test, but it's only when you're 30 and over that they give you the HPV co-testing. And then they also may give you the HPV test if your regular Pap tests come back abnormal. And cervical cancer screening with the Pap starts at 21. for women.
Interesting. Well, with we know that we have an HPV vaccine. So who is it recommended that should get it? And then also, how effective is it?
Oh, so the HPV vaccine is highly effective. It works really, really well. Since vaccines are used to prevent diseases, it's given to children before they are exposed to an infection. So most people are going to be exposed to the HPV in their teens or early 20s. So it's best to always get the vaccine beforehand, like way beforehand. So the recommended group is to start at 9. So 9 to 12. So it's 11 to 12, but we can start as early as 9.
And how often, I mean, are there boosters, or is it a series of vaccinations? And then also, what happens if, say, I didn't get it as a child and now I'm in maybe my mid-20s or something like that? Is there a cutoff date for the vaccine?
Well, so for children 11 to 12, they should get 2 doses of the vaccine. It's given 6 to 12 months apart. But like I said, the vaccine can start as early as 9 years. So if you're like under 13, you can get the 2 doses. And then if you're over 13, it's called like the catch-up period. So you can still get the 2 doses. But after your 15th birthday, you would need to get 3 doses given over 6 months. And then everyone through the age of 26, if they have not been vaccinated already, can still get the vaccine. Though the vaccine is not recommended for anyone over the age of 26, some adults can still get it. I think policy passed a couple of years ago that adults ages 27 to 45 who have not been vaccinated already can still get the vaccine after speaking to their provider and then determining their risk for new infections.
Have the vaccination rates, Dr. Dang, improved at all? I know they came down quite a bit during the pandemic.
Yes, they have. So vaccination rates for the HPV vaccine is a little bit slower than the other 2 that's recommended for this age group. So the other 2 is the Tdap and meningitis vaccines. So those are way above the Healthy People 2030 goal of 80%. But the HPV vaccine is lagging a little bit. So it's been a slow uptake of the vaccine, and the COVID didn't help. So definitely COVID has put a lesser emphasis on primary care visits. So less children were going in to get the vaccination. We see a little bit of like a climb up a little bit, but it's nowhere near the 20%, the 80%. So let me pull up the numbers right now. So the CDC has an annual report that talks about like the vaccination rates and the current vaccination rate. So in 2021, HPV vaccine coverage was at least 1 dose was 76.9%. So it was a little bit of an increase from 2020, 1.8 percentage point increase. And then the HPV up to date, that's getting the 2 shots if you needed it or the 3 shots if you needed it, was at 61.7%.
And even before the pandemic, I know you've done a lot of research, Dr. Dang, in the area of vaccine hesitancy, especially as it relates to HPV. What's the root cause? I know when I had my sons vaccinated, I felt like I was the only parent doing so. Yeah, I was working for the American Cancer Society at the time, and it had been well documented as, being the one, thing you can do to help your children from getting cancer at some point in their lives. Is there still that sort of parental hesitancy?
We see parental hesitancy around HPV vaccine misinformation and disinformation, actually. A lot of that coming from social media and internet. So a lot of parents are still a little bit hesitant about the vaccine. And some of the research that I've done that looked at like barriers to facilitators was that they, like I mentioned earlier, that it's related to a sexually transmitted infection. So when providers talk to parents about getting the shot for their children, the first question is always, how do you get it? And that conversation immediately leads to, it's an STI, and that really gets parents thinking, my son or daughter is not having sex, this is too early, they don't need to have this. And there's actually studies that have been done that shown that getting the HPV vaccine does not lead to earlier sexual debut, despite what parents have thought. So in terms of the concerns that I've heard, it's around waiting longer, wanting to vaccinate when they're a little bit older. But I did mention that you want to vaccinate as early as possible so the children have a chance to build up the antibodies. And I think parents are just a little bit more hesitant around it because they consider it a newer vaccine, though it's been out since 2006, and there's been so much research done on it. Yes. In terms of other like type of hesitancy, it's multi-level factors, provider level factors, health system level factors, particularly among our rural areas where the HPV vaccination rates are much lower than in our urban areas. And that's like access to the vaccine as well.
Okay, so let's just say quite clearly, parents, please get your children vaccinated on time. It's very important.
Yes.
Well, as your role of the executive director for the Office of Community Outreach and Engagement for the Comprehensive Cancer Center, what does that office do to help educate people about HPV, especially where it relates to maybe some of the rural or the indigenous populations?
So there was a report that came out in 2019 that looked at HPV vaccination rates in California and by county. So even though the overall rate for California having like the initial one dose was 81.7%, which is higher than the national one, if you broke it down by different counties, the rates range like really big from 34 to 73%. And when looking at this report, I noticed that we have a 19 county catchment area, and there were several counties in our catchment area that have very, very low rates of HPV vaccination, particularly the Colusa, Glen Tehama. They had the lowest rates in all of California. And that was very alarming, particularly because we really want to focus on getting shots in the children as soon as we can. Besides Colusa, Glen Tehama, Sierra, Yuba had very low rates of HPV vaccine uptake, and those are all counties in our catchment area. So when this report came out, we were funded by the NCI to do an environmental scan about some of the barriers and facilitators. And it looked like the barriers to vaccination was a little bit different for our rural counties. There was a lot more noise around vaccination in social media. Like I mentioned earlier about misinformation, there were a lot of signs and posts online about why you shouldn't get your children vaccinated. So because of that, I've spent the last 5 years really trying to develop interventions to address some of the misinformation and working with diverse community members as well as the community clinics that they attend to get their children vaccinated. So it's been a multi-pronged approach from community all the way to the clinic.
What do some of those interventions look like?
So I said it's a multi-pronged approach. So one of the things we do is I go out and do a lot of education on HPV with community members. So we would go do some community focus groups and learn a little bit more about what their thoughts were on the HPV vaccine, develop a workshop around that, and then present it at local community places. And in terms of working with the community clinics, I do a lot of HPV vaccination trainings with primary care teams. So not just giving the message to providers, but through these interviews that we've done in the past, it's everyone on the care team needs to have that strong recommendation. And surprisingly, or not surprisingly, the medical assistants and the front desk staff have a lot of power and sway over parents. I would get these interviews where parents and MAs would tell me that after the provider leaves, they would ask the MA, like, so would you get the shot for your kid? Or have you heard about the vaccine? So these kind of questions are not being asked to the provider, but more of the support staff. So when it was just coming out in a lot of interviews. So when we developed our intervention, it was trying to do a whole primary care team clinic training. And the other thing that came out was there was a lot of missed opportunities for vaccination. So you normally think vaccination, it would be a well child visit or a sports physical. But you can vaccinate during acute visits too. So I had on one of my slides was, broken leg vaccinate, so that regardless of what happens, you can still vaccinate. And I just remember that one of the providers ran up to me during a separate meeting and was like, I remember what you said. She came in with a broken arm and I vaccinated her.
It's not going to hurt. It's It'll only help.
Exactly.
Dr. Dang, as you were reading off the counties where you're seeing a lot of HPV vaccination hesitancy, I was actually glancing at a map of HPV-related cancers, a similar map. And it looks like the counties you had mentioned where we're not seeing the vaccinations are truly seeing a higher incidence of HPV-related cancers. Correct? I mean, Tehama, Glen, Colusa, Siskiyou, Trinity, Modoc. In Northern California, the far end of Northern California seems to really have a high rate of these types of cancers.
That is correct. So Tehama, Glen, Colusa, which is in our catchment area, have the highest rates of age-adjusted HPV attributable cancers in all of California, and they happen to have the lowest rates of HPV initiation completion. So our approach really is to try to share the data with them, because when I go out, they're also very surprised that this is the data that's in their own backyard. And once they hear about it, everybody wants to do something. So we've gotten a lot of good community support around our initiatives to increase vaccination.
That's great news. Well, and tell us about the HPV Vaccination Roundtable that you're co-chairing.
So the Roundtable is a statewide effort, and I co-lead the Health Systems and Providers Workgroup. So last year we decided to host these HPV learning collaboratives and really try to engage anyone who's working in HPV vaccination to share best practices and lessons learned. So every quarter we meet for a Learn at Lunchtime series. It's about 45 minutes long, and it's really to share best practices from any of the health systems that are in these counties, as well as hear the latest research from researchers, and just build a community of practice around HPV vaccination. So we are in our second year of that collaborative, and it's going really, really well.
To be proactive like that is certainly going to help. What about this? We've actually done some research here at UC Davis indicating that women over the age of 65 are dying of cervical cancer at higher rates than we used to see. And there's some thought that these women did not get the HPV vaccine. Of course, they didn't get the HPV testing. What is your message to older women who think they're safe from cervical cancer?
I strongly believe in early detection and trying to get the PAP and HPV co-testing as often as recommended. And for those older women, I think that the cutoff is it 65 or 70?
It's 65.
It's 65.
Mm-hmm. So the thought is, if the guidelines were raised, and women over the age of 65 could still get the PAP and the HPV test, it might not be a bad idea.
Yeah, I think we need to have some more research on is that the best way to go in terms of if it makes sense to do so. But I think if you were advocating to get the HPV vaccine, you would be able to get the vaccine. A very strange thing that's been happening is the rise of HPV in nursing homes. So
interesting.
Yes, and I have some colleagues who are looking at that as the next age group to try to get some policy passed on that.
Wow, I had not heard that, but maybe the two are related in terms of cervical cancer showing up in older women. I had no idea. Breaking news right here on Beat Cancer.
I mean, if you really think about it, at that time, people are starting new relationships. Second relationship, third relationship, and they do the 45 because people are saying that because that's the first time some folks get divorced in that group and are looking for new relationships, and that's why they advocate that if you are going to be at risk, at a increased risk for infection, then it would be a shared decision making with your provider.
What about certain populations like Asian Americans? We are seeing higher rates of HPV related cancers, correct?
That is correct. So that is the The main reason I decided to be a health disparities researcher, because cervical cancer incidence rate in the Vietnamese community was so much higher than in non-Hispanic white communities. So when I first started looking at the statistics, it was 43 per 100,000 Vietnamese women were being diagnosed with cervical cancer compared to 8 out of 100,000 for white women. So I was just, when I heard about that statistic, I just was, I didn't have the words. I was just like, oh, okay. And then it was just something in my community that I really wanted to focus on because I've seen it in the community. And then I learned more about it and realized like a lot of these barriers are related to culture, social barriers, and decided to dedicate my career to change that statistics. Now it's good to know that we're doing a lot better. So these like 20 years of cervical cancer early detection programs that are culturally appropriate, tailored for the communities has made a difference. So even though we're a little bit higher, but we're not the 43 to 8 anymore.
Well, that's very interesting. You could tell your devotion to the cause, and it's nice to have the backstory on that, Dr. Dang.
Yeah, is there anything further that maybe we didn't cover or didn't ask you about that you would like the audience to know regarding HPV and or cervical cancer or just even the risks of cancer related to HPV?
I think the biggest message is that HPV vaccination is cancer prevention. It is one of 2 anti-cancer vaccine that we have that's available. And I'm sad to hear that not more children are getting the vaccine. And I'm so happy that the Cancer Center and there are other researchers out there trying to do not only interventions that I do, but learn more about the science behind it, learn more about the policies, see if we could change some of those policies. But the big message is it's anti-cancer. Like, why would you want your kids to get cancer? And you really don't think about it because it doesn't happen till later on in life. But if you can prevent it today, you can prevent almost 100%. You can almost eliminate cervical cancer with the HPV vaccine and early detection. Imagine that.
Right. Well, thank you for all of the work you're doing in this area.
Thank you for having me and letting me share.
Absolutely. Thank you, Dr. Dang. Well, thank you for tuning in and listening today. If you'd like to get in touch with us, you can email us directly at beatcancer@ucdavis.edu. Beat Cancer is a production of the UC Davis Comprehensive Cancer Center. For more information on our NCI-designated Comprehensive Cancer Center, please visit health.ucdavis.edu/cancer.